So welcome to this video. This is Chad Clark, going live from Physical Therapy Connections here in Pueblo, Colorado. And I took this from WebPT. We're going to answer it on our own though, but I like these questions because we get some of these same 12 questions, and we want to answer them and how we help you with your physical therapy concerns and questions. And let's begin. So number one, do I really need physical therapy? So the short answer is yes. Whether you believe that or not, it truly you do. So some people might say, I don't have pain, I don't have any injury or weakness, so what's that going to do? Well, we have functional movement screening, even a fundamental capacity screening that we're certified to do, and that shows how you can even perform better. So if you're doing CrossFit or you're doing your high intensity workouts or obstacle course racing or any recreational activities you do, you can always get better. So you might have some underlying flaws or issues in your movement. We can test those out with our functional movement screening and fundamental capacity screening to make you even better. Now, if you have pain, injury, or weakness, even if it's a little, medium, or a lot, as far as pain and weakness, we can definitely help you out with that. Number two, do I need to obtain a referral to see you? Meaning, do I have to go to my doctor first? No. Colorado is a direct access state. It's very liberal in its rules where you can come in anytime. So if you sprain your ankle right now, you can come down and we could evaluate and treat you and get you going faster and better. So that's usually not a problem. If you want your insurance to pay for it, there's a few insurances that require a referral, but we're seeing more and more people with health savings accounts and deductible plans that are so high that it doesn't even matter. You don't need the referral. Will physical therapy hurt? Again, another short answer, no. Our mantra here is to keep it safe and pain-free. It should not hurt. If you're going somewhere and you're worse or it hurts and you dread going or you have to take more pain medicine to go, that's stupid to do that, and you should go somewhere else. You should immediately tell them this should not hurt. Talk to the therapist first, but otherwise I would go somewhere else. Have you gone to school for this and are you any good? So yes, we've gone to school, and I graduated in the 90s, so they were mostly a master level program. I went to a 4-year undergraduate, bachelor's in science, then a master's in science and physical therapy. The two other physical therapists here have doctorates, so they have their bachelor's, master's, and doctorate degree in physical therapy, so it's usually more extensive training than most people think. It's pretty much 7 years. Some can do it in 6, but it's between 6 and 7 years after high school graduation that you spend specializing in field of physical therapy. And are we good? Yes. Yeah, we wouldn't exist if we weren't. How long will PT take? We see a lot of people, well, let's say this, half the people get a good result and they're feeling better after 1 session. Of those people, a majority are better in 3 or 4. Our average is 6 to 12 visits for that particular condition. The reason why it's a pretty big range is some of those people have had surgery, so we're going to see them closer to 12 times. The people that are here for pain, injury, or weakness but no surgery, it's closer to 6. Each session is approximately 45 minutes long, although they could go up to an hour or more in some cases. Does insurance pay for PT? Yes, it does. We're in network with most insurances. However, a growing population that we're seeing more and more because of high deductibles and co-insurances and co-pays, they're just paying our private pay rates and our packages, which is more affordable and just better anyway. Then we can dictate, and us as a team, how you can get better, and we're not controlled by insurance. So I wouldn't let that dictate if your insurance, even if we're not in network, you're going to get better care, usually how to network, and it's not that much more expensive, if at all, more expensive. Will I have to get undressed? No, it's not like a doctor's office. You just wear loose, comfortable clothing. We have shorts or those lovely gowns that we can provide you, and you do not have to get undressed. How are you going to be able to lift me up? Most people, like 99% of the time, we never have to lift you up, but if we do, we have gait belts. We have enough people here that are properly trained to do it safely and not hurt you or hurt us in the process. And then why are you asking me about bowel and bladder function? Well, here, 2 reasons. One, we have a pelvic floor and a bowel or bladder incontinence program that we help people with. And if you're not coming for that, and let's say it's low back pain or you've had low back surgery or you haven't had surgery, If you're having bowel or bladder dysfunction and incontinence, that's a bad thing, and it might require immediate medical urgency, medical treatment, possibly even a surgery. That's why we ask stuff about that. How will I know if PT is working? You will know because we will ask you each time 3 questions. Are you better, worse, or the same? And it's one of those answers. If you're getting worse, which rarely, if ever happens, we'll immediately change the course of treatment. Some people, they're the same. They don't notice a lot of changes maybe after the first time or two. There's just that particular group. It sometimes takes 2 or 3 weeks. If it's been going on for 10 years of back pain, it might take a few weeks to notice big measurable changes. But we always do what we call a test, treatment, retest. So if you're having problems and you just can't bend over, we're going to do our treatment and then retest that, and almost always you're going to have at least a few inches, if not a significant change, and you'll know you're getting better at each treatment. That's another thing we find when people come from other clinics. They'll go 12 visits, sometimes 20 visits. They'll max out what the insurance pays, and at the very end, they're discharged, and then the PT finally asks, "Oh, are you any better?" Well, that's pretty silly, because you should know each time that you're on the right progress, so we can make immediate changes in the plan of care if you're not getting better quickly. Can you prescribe medication, pain medication? No, we do not. Even though there are doctors of physical therapy, there's still no prescription that we can write for medicine. We do everything all natural, and we like that. We actually love that, because, and people love it because it's all natural. There's no side effects. There's no drugs we deal with. There's no injections, and there's no surgery. You're going to find now that we use movement and some other modalities like our laser and BioQ Pulse and some other things to help with pain control. But mostly what's going to help you is our hands-on treatment and our movement. I say it that way because exercise, it's not about getting on a bike or a treadmill, and then, by the way, if you're doing that in physical therapy, you just stop that. That's silly. And if they're having you ride a bike for 10 or 15 minutes before or during your treatment and putting you on like ice and electrical stimulation, I would go somewhere else. I'd stop immediately and don't pass go. Just go to another clinic. So everything's all natural, and we don't prescribe pain medicine, and people love that. And then this one is kind of a different question, but can you treat my grandmother too? What that's alluding to is we see people of all ages, and sometimes you might be here in the afternoon and we're seeing a lot of 20 and 30-year-olds or maybe 40-year-olds, and they don't realize that, yes, we see quite a few people, and here it's close to half any given day that they're over 55, usually in the 65 to 80-year-old group. We do see more females than males typically, and it's the typical grandmother type that has had a knee replacement, or they're just having problems with their balance or their vertigo, maybe even plantar fasciitis or shoulder problems, and we'll see the grandmother type people as well. So we see ages, we usually don't go much below 5 years of age, but we'll go as high as possible, or high as someone that's willing to come in. They're usually 85 and 90-year-olds. That's a growing population. Some are even mid to upper 90s, and I'm sure soon enough we'll see people in their 100s coming in. So those are the top 12 questions that WebPT, that I took from WebPT, but I thought they were great to answer on our own here at Physical Therapy Connections. Please call or share this if you find this helpful. We're at 719-565-6678 or at thept-connections.com, and we have lots of great videos to show what we do and how we can help you out.